Cariprazine, brand name Vraylar, is an atypical antipsychotic medication used to treat psychiatric disorders. It is a selective dopamine D3/D2 receptor partial agonist and a partial agonist at the serotonin 5-HT1A receptor. It is approved by the U.S. Food and Drug Administration, FDA, for the treatment of schizophrenia and manic or mixed episodes associated with bipolar I disorder in adults. The recommended laboratory test before starting cariprazine include complete blood count, CBC, liver function tests, LFTs, kidney function tests, KFTs, fasting glucose, A1C, lipid profile, electrolyte levels, and thyroid function tests, TFTs. It is also recommended to monitor for changes in weight and blood pressure. It is important to review the patient's medical history, including any pre-existing conditions and any current medications they are taking. The starting dose of cariprazine for schizophrenia is 1.5 mg taken orally once a day with maximum recommended dose of 6 mg per day. For bipolar mania, the starting dose is 1.5 mg per day with maximum recommended dose of 6 mg per day. For bipolar depression, the starting dose is 1.5 mg per day with maximum recommended dose of 3 mg per day. The exact dosage should be determined by a healthcare provider based on the patient's individual needs and response to treatment. Common side effects of cariprazine may include nausea, vomiting, constipation, headache, dizziness, and restlessness. In some cases, more serious side effects such as tardive dyskinesia, involuntary movements of the face, tongue, or extremities, and changes in mood, including depression and suicidality, have been reported. Cariprazine is contraindicated in patients with known hypersensitivity to the drug, and it should not be used in combination with strong CYP3A4 inhibitors or CYP3A4 inducers. Additionally, there is a warning for cariprazine, indicating that it may increase the risk of suicidal thoughts and behavior, especially children and adolescents. Patients taking cariprazine should be monitored for changes in their mental and emotional state, and the drug should be discontinued if significant changes are observed. A healthcare provider should be consulted before discontinuing the medication. There is a warning issued by FDA regarding the risk of mortality in elderly patients with dementia-related psychosis who are treated with antipsychotics. The warning states that these drugs have been associated with an increased risk of death in elderly patients with dementia-related psychosis compared to those who do not take the drugs. It is important for patients and healthcare providers to be aware of this warning and weigh the potential benefits and risks of treatment before starting or continuing therapy with cariprazine.